The one word we've got is hope, because there's lots of things you can still do at this age. You're still very functional. You just have early stages of Alzheimer, and that has to be guided. As things progress, and this is a progressive neurodegenerative disease, then we're going to get into the middle phase. What's the middle phase like, Monica?
The middle phase is the most challenging phase, particularly for caregivers. They've already dealt with the diagnosis, accepted the diagnosis, and this is the stage that requires so much care. And this is a stage that can be isolating because a patient is still able to get out and about, still talking, still walking, and may have preserved activities of daily living, still perhaps uses the bathroom by themselves, etc. And now they require a lot of day-to-day care, maybe in dressing, maybe in just doing simple activities.
Being with the patient, arm in arm, not letting them go out by themselves, middle stage, as it progresses?
Yes, I think that you see more wandering at this phase, and that can be really frightening for a caregiver. What I see is that exhaustion and burnout. So it is important to also seek help. Let's say if you're starting to experience depression, anxiety, sleep problems, to really talk to your primary care doctor about those issues. That is unfortunately extremely common.
Sure.
And then the other thing that actually comes up quite frequently are many times, especially if it's a younger, early onset disease, there is a tremendous loss of income. So there's financial strain at this phase.
I bet that would be, and finances are often strain on every couple. So an added, not planned for, stress would be really very, very difficult for people. So that's the caregiver. What's going on with the patient now as they're advancing in middle stage? What are they doing and not being able to do? And what are the problems?
Well, if you can imagine, there's a loss of initiative, not able to plan one's day. So you take someone who's highly successful and really not able to do much of anything without that initiative of a caregiver. So it's that constant care that is really challenging. And so I encourage time off again.
Can the caregiver say, let's go out for a walk, honey? And are they able to go out for a walk and manage stair steps? And
It depends on the illness.
Yeah, so it depends on how far.
And it depends on the person too.
Sure, so it depends on their strength and their size and what other problems they've got. I think the best thing is that there are services available for both the caregiver and for the patient.